Hello, Emilios. Hello to everybody. Thank you for your kind words, Emilio. Today we will talk about the urea, a century of proven clinical efficacy in dermatology. What is exactly urea? Urea is a polar hygroscopic molecule produced by the human body that plays an important role in the metabolism and excretion of proteins. Urea is part, almost 7% of the component of the natural moisturizing factor known as NMF of the stratum corneum, thus playing a key role for the maintenance of skin hydration. Historically, urea is a compound that has been used for more than a century in dermatology, and it is known to be effective for conditions associated with dry and scaly skin. Importantly, when used at a different concentration, urea may exert different action. Namely, if you use a low concentration, below 10%, may have a different action compared to higher concentration, where is more than 10% of a urea concentration. Let's just start to discuss a little bit about the therapeutic properties of urea at low concentration. Low concentration, below 10%, urea exert a moisturizing action. How? Urea acts as an humectant, which means attracts and retains water in the stratum corneum. It's also able to attract water from two sources, the dermis and in human condition, the external environment. Let's take a look to what is the mechanism of action of urea at high concentration, more than 10%, keratolytic action, which is done through the fact the urea induces protein conformational changes by breaking hydrogen bonds, reducing cohesion of keratinocytes. So, keratolytic action when it's more than 10%, moisturizing action when it's less than 10%. Based on these different properties, there are a variety of skin conditions in which urea can be used, from xerosis, ichthyosis, atopic dermatitis, psoriasis, diabetic foot onychomycosis, keratosis in general, seb care, contact dermatitis, radiation-induced dermatitis, sorafenib-induced skin reaction, dystrophic nails, tinea pedis, pruritus, and many more. And interestingly, basing on these different mechanisms of action, different formulations are available of urea, and that include concentration that may vary from 2% to 50%. On your left side, you will see the different formulations which are available all over the world. Lotion, emulsion, solution, cream, gel, foam, ointment, nail lacquer. So normally, it is better to classify the action of urea in low concentration, which is related to 2 to 10%, medium concentration 15 to 30%, high concentration 40 to 50%. Remember that the more urea concentration we use, the more are the chance of potential skin irritation. So between 2 and 10%, the chance of irritation is very minimal. Of course, if you go to 40 to 50%, patient may experience some stinging, burning, or some redness, which is, however, temporary. Let's just take a look to low concentration. What is the evidence in literature on the use of urea at 2 to 10% in cirrhosis? Several randomized clinical trials support the efficacy in urea in the treatment of simple xerosis and in cirrhosis related to disorders with the inability of the stratum corneum to maintain hydration, such as ichthyosis, atopic dermatitis, and psoriasis. All of these RCTs has been based on clinical assessment, on instrumental evaluation of TEWL and stratum corneum hydration. There are 11 trials on ichthyosis, which shows that urea 2 to 10% is effective and well tolerated. And here there is a study that we have conducted in my department with a 10% urea emulsion twice a day for 30 days in 5 patients with Iosis vulgaris. And we did video dermoscopy and confocal microscopy evaluation. This was a preliminary study. All patients showed an excellent response with significant clinical improvement of cirrhosis and itch. This is a clinical image of one patient at T0 at baseline scored 3, and after 6 weeks we see that is scored 0 with complete clearing. And also you can see at dermoscopy on the upper part of the slide, you see the scales before and the absence of scales at the control, which we evaluated the scored 0. Same with confocal on the bottom of the slide, showing normalization of furrows, sides, and morphology. And so baseline is on your left and after treatment on your right. Always talking about urea low concentration of also in atopic dermatitis is pretty effective. 11 trials associated or not with corticosteroid, effective and well tolerated. And remember that in atopic dermatitis, the basic therapy is very important and is based on moisturizers. And most of the moisturizers that are in the literature are urea based. So this is perfectly in line with all the current guidelines for treatment of atopic dermatitis regarding basic therapy, which is a very important step in the management of these disorders. This is a systematic review. Again, it's confirming what I was said before. Among different type of moisturizer, the clinical effectiveness appear most well documented for urea-based preparation. And this is another meta-analysis that we did on atopic dermatitis treated with topical moisturizers. And we evaluate 92 randomized clinical trials. The efficacy moisturizers containing urea have shown the greater evidence of efficacy. Concluding the range of possibility to treat disorder with 2 to 10%, also cirrhosis of the feet may take a lot of advantages by using urea, a low concentration. Diabetic patient have a high incidence of cirrhosis of the feet with increasing risk of ulceration. Urea is safe and effective. Moving to medium concentration hyperkeratosis. Medium concentration can be used in case of low to moderate hyperkeratosis involving large areas, as in this patient that you see on your left. Of course, we have always to balance the keratolytic action with the possible skin irritation. And again, other cases out from our department, urea 30%, cream for 2 weeks in the ear, you see, and around the belly, with complete disappearance of hyperkeratosis, which facilitate also the use of the appropriate pharmacological treatment. Moving to high concentration, 40 to 50% hyperkeratosis, chemical plate avulsion. You see here, useful in case of severe hyperkeratosis involving small areas, as you can see here. You see here, urea cream 50% for 2 weeks. Some of these hyperkeratotic lesions are very stubborn. This is a clinical study we did on 25 patients with plaque psoriasis with evident hyperkeratosis component, a 50% urea anhydrous paste twice daily for up to 3 weeks, clinical assessment and high frequency ultrasound, clearance in 92%, no side effect, and baseline after 2 weeks. Great result, as you can see here, complete disappearance of hyperkeratosis. And ultrasound showed a significant reduction of the mean epidermal thickness, approximately 50% reduction, reaching a thickness similar to normal epidermis. Here we are at baseline, any year after 2 weeks with a thickness similar to the normal epidermis at ultrasound. Finally, urea can be used also for chemical nail plate avulsion, nail dystrophy, onychomycosis, psoriasis, or in case of pachyonychia or onychogryphosis, as you can see in this. But usually in these cases, 40 or 50% should be treated under occlusion. Remember also that urea can be used as a penetration enhancer in onychomycosis combination treatment of 20 to 40% urea with antifungal agent and be shown to be superior to monotherapy. This is my last slide. Again, low concentration, 2 to 12%, xerosis, ichthyosis, atopic dermatitis, psoriasis, xerosis of the elderly, medium concentration, mild to diffuse xerosis, hyperkeratosis, is in psoriasis, chronic eczema, etc. Hyperkeratosis localized in sensitive areas, face, genital area, and high concentration, moderate to severe, localized hyperkeratosis, psoriasis, calluses, warts, keratoderma, etc., or nail plate avulsion. Conclusion: despite the new continuous discovery of new compounds, urea is still one of the most useful molecules in the end of dermatology. Urea containing products are available at different formulation and concentration, providing several alternatives for the management of many skin conditions. Urea products have generally few adverse effects, and there are no reports of sensitization despite its widespread use. Thank you for your attention.